Having worked as a healthcare assistant with State College Hospital, I worked in a chemotherapy unit where it is quite a bit emotional sometimes, and I've done some NHSP jobs in other wards, and working, doing all these things, meeting patients and hearing their problems and seeing a lot of things, maternity, gives me much confidence and feel like coming into it full time because I did part time with King's College Hospital to help patients.
I've chosen to become a nursing assistant. After working in offices on computers, I decided that I wanted to do a job that makes a difference to people, caring and totally different from what I've done before. Just to do a job where I can make someone's stay in hospital a bit more pleasurable.
I've got the passion for caring for people, especially helping the sick ones, and my zeal to carry out this assignment is to help people that are not feeling well, and I love to become a nurse in one of the hospitals to further my career in nursing.
Hello, I'm Sarah Joseph, matron for orthopaedics. I chose nursing as a career because I wanted to sort of be working with people that needed help. Also, my mum was a nurse, so I followed in her footsteps, and I've been sort of qualified since 1990. I've been here at Kingston since 1998 and enjoyed my time here.
I wanted to be a nurse because as a little girl I think I liked the idea of it, but I have to say it has kind of lived up to what I thought it was going to be. I'm currently a diabetes specialist nurse, so I see patients in an outpatient situation and I see ward patients, so I've got the best of both worlds, if you like, and I can honestly say I love my job, I love my patients. You have your good and your bad days, but by and large it's fulfilled all the things I thought it was going to be.
Hi, I'm Claire Wright. I'm a senior sister on Isabella ward, which is a gynae and breast ward. I've always wanted to be a nurse since about the age of 5, and that could be partly due to having a mother that was always in and out of hospital. I really wanted to make a change into the way patient was looked after and cared for, and make a difference in their patient's journey.
Freya, staff nurse. I went to work in a nursing home before I went off to university for the first time, and I absolutely loved it, so I think that's really why I just enjoy taking care of people really.
A long time ago I was working for a local newspaper in advertising, and I always knew I wanted to go into nursing and make a difference, or try to make a difference for patients, give good care, good standard of care and safe practice.
Right, I believe nursing is a very rewarding job, and it makes me really happy when I see my patient is cared for and they are happy and safe.
I decided to train as a nurse because when I finished school my grandparents got very ill and I went and looked after them, and I just found it incredibly rewarding, and the local doctor told me that I should go and become a nurse. I've learned so much and I've had so many opportunities to do all sorts of different things, and it just makes me excited for when I qualify.
So I decided to train to be a nurse. I'd always been interested in healthcare, but then I did a degree in psychology. After I graduated from that degree, I then started working in a hospital and just really enjoyed caring for people, personal care, chatting to families and relatives as well as patients. So then I trained on the postgraduate programme at Kingston. So I've done most of my placements at Kingston Hospital, which has been really great. So I'm newly qualified now. I've been working on the ward for about 1 month on care of the elderly, and I love it. Yeah, it's a really rewarding career.
My name's Rebecca. I'm a sister on Ryde Ward. I came into nursing originally because my mum was a nurse for adults with learning disabilities. I've been qualified now for some years, and I saw the role, so I want to make a difference to patients.
My name is Susan. I'm a discharge coordinator. I've been nursing for 37 years. I came into nursing when I was 19, following a couple of days work experience in a geriatric ward, which I enjoyed very much, and I still, even now, enjoy the feeling of being able to help somebody and to care for them and get them back to a stage where they can go home and look after themselves, or as I do today, assess them for appropriate placement.
I love being part of this mad team of people, and I get great job satisfaction. For instance, today we had a patient and his wife, an old patient, come back to see us, and they gave us a lovely card, and he expressed his thanks and was very tearful. We were all quite tearful and choked. And he said that we helped him through a very difficult experience, and we made it bearable through our kindness and patience, with a lot of jolly humming and smiling. So it's really pleasant and lovely when they come back with these cards and say thank you. And another lady who also came yesterday with a big basket of fruit for us, and just to say how grateful she was.
My name's Marnie Ramshaw. I work in intensive care at Kingston. I started off as a healthcare assistant on Isabella Ward. I was then offered the opportunity to do my NVQ level 3 in health and social care, and I also did my maths GCSE in an external college. I then was offered the opportunity to get a secondment to study my nursing at Kingston University. I started off on the diploma programme there, and after 2 years I was lucky enough to be asked to swap over to the degree programme. I then continued with my studies at degree level, and in June of last year I finished the degree programme with a first. And then I had my second to last placement at Kingston Intensive Care, and they actually offered me a job. So my first staff nurse post was where my last placement was as a student nurse, and that's where I am now. You make a difference to people's lives every day, and especially here, you're in the real acute phase, so they might not necessarily remember their time here, but it's one of the most important phases. It's the real acute phase of their recovery, I suppose, from the minute they come into hospital. But yeah, it's an amazing place to work.
My name is Neil Burns. I'm a staff nurse in the Acute Assessment Unit. I decided to do nursing after watching palliative nurses look after my grandmother, and decided it was a worthwhile job to take under hand. It's a very challenging but very rewarding job, and I wouldn't change it for the world.
My name's Patrice. I'm a nurse 4 years now. The reason I came into it is because I like to see people when they're ill and work through the process of getting them better. Like to do that to the best of my ability, like to work as part of a team, and we try to do that here in Kingston Hospital.
My name is Miriam Allen. I'm an intensive care nurse and I work here at Kingston Hospital. I get out of bed every day to come here because I absolutely enjoy the environment that I work in. I love the staff, brilliant group of people, very team orientated, everybody mucks in, everyone supports each other, lots of support here. And our patients, sadly, are wonderful, if that makes any sense. We work hard